Gears now to the demographic health survey, and at least 26% of women and 27% of men in Kenya have health insurance coverage. The Kenya National Bureau of Statistics unveiled its 7th demographic and health survey, which was conducted in 2022. The government says that total fertility rate in Kenya now stands at 3.4 births per woman, down from 3.9 births in 2014. On the other hand, Kenya has made great strides in family planning, as 57% of married women use modern methods of family planning. NTV's Helen Aura puts those figures into perspective.
The 7th Demographic and Health Survey of 2022 has elicited mixed reactions. While the country is reported to have made great strides in ensuring Kenyans attain universal health coverage, the number of those who are under a health insurance cover is seemingly underwhelming. The data unveiled by the Kenya National Bureau of Statistics indicates that 1 in 4 persons in Kenya have some form of health insurance. The National Hospital Insurance Fund, NHIF, is the most common insurer at 24%.
We have women being 26% and men at 27%. When you break it into urban and rural, then you are able to see that urban, the coverage of the proportion of urban residents who are covered by health insurance is higher than that of rural. And of course, in urban, men tend to be more covered than females.
In the 3-year period before the survey, the total fertility rate has dropped to 3.4 births per woman, down from 3.9 births per woman in 2014. The total fertility rate is higher among women in rural areas than those in urban areas.
We have had the fertility levels going down, and this is the joy that we have. We still expect it to go down if our policies and interventions are still pointing in the right direction.
More than 4 in 10 currently married women want to limit childbearing. 43% want no more children, and 3% are sterilized. 63% of current married women are using a contraception, with 57% using modern contraception. Among the sexually active unmarried women aged between 15 and 49, 70% use a contraceptive method, and 59% of those women use a modern method. The common modes of family planning among married women are injectables at 20%, implants at 19%, and the contraceptive pills at 8%. Among sexually active and married women, male condoms are the most commonly used contraceptive methods at 20%, followed by injectables at 16% and implants at 11%.
Only 54% of young people in Kenya know about HIV prevention, with the lowest awareness among 15 to 17-year-olds, where only 44% of them are actually aware of HIV prevention mechanisms and how they work. And this is, again, worrisome, as this also is the population that bears the highest incidence or new cases of HIV.
Policymakers hope this will inform policy going forward in a bid to scale up services to Kenyans. Helen Aura, NTV.